just looking at the line in this busy waiting room give you anxiety? Right? Just sitting at that? Now today, nurses' secret time savers at the doctor's office to get you in and out like this. Because remember, nurses are the official timekeepers of every doctor's office. Nurse Alice Benjamin is joining us. She's also known as America's favorite nurse. And I'll admit that I hate waiting around in lines. I'm just going to show you an example, not in a doctor's office. This is me waiting in line at the DMV earlier this year. See how happy I look? Right? No one else is happy either. So Nurse Alice, in defense of all the docs, like, why is it that sometimes we run behind? What's messing up our schedule?
So docs like you are always late because people are so excited to see you. They've seen their Google doctor, and now they have some time to talk to you, and now they want to get all their real questions answered. But appointments also run behind because sometimes someone's coming in with signs and symptoms of a stroke, a heart attack, or something urgent. So those people get to cut the line, regardless what their appointment time is.
I wish it was that predictable. So for that reason, we sometimes are doing what we don't want to do, which is run late. On average, how much time does a patient have to wait in our office?
The average time is about 20 minutes. Now, it's not always. Sometimes it's shorter, and sometimes it's also a little bit longer. But again, it's because things are happening in the office. And, if someone's coming in with an urgent need, we're hopeful that everyone will understand that that person needs to be seen.
But you've got some secrets, some time savers for us all. Right? You ready?
Yes.
The best time to come to the doctor's office turns out to be the early morning or after lunch. Now, why is that?
That's because you're first on the list, right? So if you're the first appointment of the day, the doctor's fresh, you're in there, you get to go in and out, no wait, right? So that's perfect. And then also the same rationale after lunch.
You reset.
Yes.
All right. Now, best day of the week. This is interesting because you might think, it doesn't make a difference. They're seeing patients every day. Not true. What is the best day to book your appointment?
Best day is Wednesday, midweek. And the reason being is because Mondays are very hectic days, right? So much has gone on during the weekend. Everyone's racing to get to the doctor, and they all want to be seen. Yeah. And the same thing with Friday, right? So much has happened during the week. People have procrastinated, and now they all want to be seen before the weekend comes.
Now, there's a no-wait system. I didn't even know about this. I knew that it existed for some folks, but it turns out it's for everybody, for most people. It's 24-hour nurse helplines. Almost all insurance plans offer them. If you don't have insurance, don't panic. Our team was actually able to identify services for people who don't have any coverage at all. So explain how these things work.
So I love this, right? So often people want to have ask questions of their doctors. They don't know what to do. They're stuck. So they can often ask questions about, symptoms that they're having. Or maybe they started a new medication and they're concerned about side effects. Or maybe they want to try a new home remedy and want to know if it's safe. Yeah. They also want to know, do I need to go to the doctor right now? And it's really a great resource that goes underutilized, so I want to encourage people to use it.
And insurance companies offer this. It saves them money.
Yes.
If they can answer your questions, you don't go see a doctor, and make your experience a little better, it's better for everybody in the system. So I didn't realize how widespread they are, so I'm happy this exists. So we're going to put the information about this 24-hour nurse helpline on our website with all our other efficiency hacks. You can share them with all your buddies. You can also go to my app. It's called Ask MD, that award-winning app, to help you efficiently make sense of whatever symptoms are going on in your life. That way, when you do talk to a nurse or to your doctor, right, you'll be able to tell them exactly what's going down because you kept track of it based on this really clever tracker of what's going on in your symptoms. So since there's no waiting line with this time saver, you've actually saved 20 minutes because you don't have to go to the doctor's office to wait there. That brings us to a total of 3 hours saved.
But wait, Dr. Oz, I have a few more questions.
More questions?
I need a tip. I want to know, what is the tip to seeing you and keeping you on time? So what I did is I called the big guns, and I called my expert, Miss Flora.
Flora's here?
Flora's here.
This is my boss. Wait till she is here. This is the woman. So when I was a young resident training, and she was already at Columbia, I won't say how long you'd been there, but she was at Columbia, she would always say, your patient's not ready to have their chest closed yet. They have to be like the Sahara Desert. How would you say it?
I don't want to say too much for them.
No, I want to hear it. Just let me hear Sahara Desert.
That's the Sahara Desert. No, I don't want to say it.
So, the Sahara Desert, the chest to be so dry.
Yeah.
People bleed after heart surgery. She wanted it to be so dry that there will be no bleeding.
No bleeding at all. It's dry, then you can close. No matter how busy you are, stay here. Finish. Make sure. Okay. I don't want the patient come back. So many times they have to open. I have to go to ICU, bring all the instruments, go over there, open the patient chest. That's why you stay here. No matter how busy you are, no matter where you have to go, you have to catch the plane.
There she is, Flora. God bless you. All right, we'll be right back now.
We are the patient dreamers.